Good afternoon, everyone. Thank you so much for joining us for our weekly COVID-19 press briefing. Today, Orange County Mayor Jerry L. Demings will recognize individuals from Orange County Fire Rescue who have returned from their important and heroic work in Surfside. Welcome to you all. Mayor Demings will then deliver information on positivity rates and once again emphasize opportunities for COVID-19 vaccinations. The mayor will then convey information on rental assistance, make a push for a head start, and report on other information as well. Dr. Pino from the Florida Department of Health in Orange County is also here to discuss urgent details regarding infection rates and state vaccinations. Finally, yet importantly, Comptroller Phil Diamond is also here to discuss tourist development tax collections. We begin with Mayor Demings. Mayor?
All right, thank you, Dr. Williamson. Thank you to all of you for being here. Hopefully you had a great weekend this past weekend. But I want to start today. This is our 141st press briefing since we started our response and recovery efforts associated with the pandemic. But I want to start today and talk a little bit about some of what has been going on in South Florida with the Champlain Towers condominium collapse in Surfside. That certainly has resulted in horrific loss to many of those families in that area. I understand that the death toll is now over 90 persons. This incident is certainly one that has captured the attention of all of us throughout America, but certainly here within Florida. Joining us today, we have some members of our Urban Search and Rescue Task Force 4 from Orange County Fire and Rescue. And we have Chief Fitzgerald who has joined us as well. But I really want to recognize these brave men who responded to the call for assistance. In all, there were 42 members of Task Force 4, including Orange, Lake, Seminole, and Reedy Creek fire departments who responded to that incident. For over a week, Task Force 4 worked 12-hour shifts from midnight through noon, sifting through the rubble, looking for survivors in an incredibly dangerous condition. This was the first time in history that all 8 Florida Urban Search and Rescue teams responded to an incident. I'd like to, at this time, ask members of the task force to stand and be recognized, and I'm going to call their names individually. We'll start with Battalion Chief Garrett Winkowski, Battalion Chief Brian Beechner, Captain Mike Zalanka, Lieutenant Julio Ramos, Lieutenant Kevin Nazario, Lieutenant Eric Fisher. And now we'll go to the firefighters. Firefighter Justin Jones, Eric Olson, Wayne Blow, Keith Broccolo, Alex Rawls, and Bill Zalanka. Join me in just giving them a round of applause. Thank you. You know, I know these individuals will never want any type of recognition for the work that they do. They do the work because they have the passion to serve others and to participate in these rescues to save lives. And for that, we owe all of them a debt of gratitude for the volunteerism in this circumstance. And so we're forever grateful from Orange County that in some small way we were able to assist our sister county down in Miami-Dade. So to all of you, on behalf of all of the residents from Orange County, thank you. Thank you for your service. We'll take a photograph at the end, and you may be seated at this time. Thank you very much. So as we talk about COVID-19, I want to share with you the latest numbers that we have. Our 14-day rolling positivity rate, unfortunately, has increased dramatically for the past 2 weeks. Today it is at 7.78%, so nearly 8%. 2 weeks ago on June the 28th, it was 4.28%. We are now considered by the CDC in the high-risk category for community transmission. That, quite frankly, is not good news for our county. So therefore, I am announcing today that it is my official recommendation that Orange County return to the status in which it is recommended that all residents, vaccinated and unvaccinated, consider wearing facial coverings indoors when in crowded environments. If unvaccinated, you should mask up to protect others. That's simple. The COVID-19 virus and its variants are now primarily infecting unvaccinated persons. We continue to urge unvaccinated persons to get vaccinated. Now I'm going to call on Dr. Pino and his professional opinion to talk more about what we're seeing. He will tell you that the virus is spreading primarily amongst unvaccinated persons. In addition to the vaccine, residents can get tested at Barnett Park for COVID-19 through the end of this month, and we're making some decisions regarding whether we will extend beyond this month to do testing. But Barnett Park is open 7 days a week from 9 a.m. until 5 p.m. and offers the Pfizer and Johnson & Johnson vaccines. The I Got My Shot mobile vaccination trailer continues to visit neighborhoods and businesses throughout Orange County. There should be a graphic behind me, and that will be shown. This week, the trailer will be at the following locations. On Tuesday morning, the trailer will be at the Goodwill Industries on Taft Violin Road. In the afternoon, it will be at the Rosemont Neighborhood Center. On Wednesday, it will be at Lake Eola Park in the morning, then the Smith's Neighborhood Center on Bruton Boulevard in the afternoon. Thursday afternoon, the trailer will be at the Northwest Neighborhood Center on W.D. Judge Drive. And lastly, on Friday, the I Got My Shot trailer will be at the Citrus Square Neighborhood Center on Hickory Drive. The effects of the pandemic are still being felt in our community, especially when it comes to evictions. At the end of the month, the federal moratorium on evictions is scheduled to end. All indications are it is not likely going to be extended. I say that from various conversations that I've had with federal officials and others. If you're struggling to pay the rent or facing eviction, we have a program in place that can help you. I want to remind our residents about Orange County's Emergency Rental Assistance Program. Qualified applicants can receive 12 months of past due rent and 1 month of future rent, up to a total of $20,000. The program is available to all residents of unincorporated Orange County and the other municipalities, with the exception of the city of Orlando, which has its own program. We ask our residents to apply for this program now. It is a great opportunity to help keep your households stable. To date, $4 million has been paid out to keep families in their homes, and there's still money available to help others avoid becoming homeless. Residents can visit ocfl.net/rental assistance to see the program details, including the documents which are required. In addition, we're asking local nonprofits to help us reach those facing eviction. There will be a virtual training session on the afternoon of July the 28th for any interested organization to show our nonprofits how to help their clients and our residents apply for these funds. Organizations can go to ocfl.net and click on the application for the virtual training session. Our experts, including Ms. Diane Arnold, is here today, and they will be the ones conducting the virtual workshop. And I want to take this time to remind all parents of preschool-aged children. Orange County Head Start is taking registrations now for the fall. Classes begin August the 10th, which is less than a month away. This early childhood education programming is free to children ages 3 to 4 years old and offers daily, well-balanced meals and individual instruction at each of the 22 different sites here within Orange County. To see if you qualify or to register your student, we ask that you visit our website at ocfl.net/Head Start. We know that the centers will fill up quickly. Also, for more information or details to take advantage, we offer a phone number for you, 407-836-6590, 407-836-6590. And with that, I'm going to turn it over to Dr. Pino at this time.
Good afternoon. Thank you, Mayor. Before we move into the virus news, I want to acknowledge that Albina is also here with us today, as well as two medical students from Nova University, Tyson and Christopher, who are doing a rotation with us. So welcome. So the mayor mentioned to you that we are over 150,000 cases diagnosed in the county. 137,000 of those are residents. Our positive rate is at 7.8, and the number of deaths have increased to 1,370. Those are 8 new additional deaths since we talked to you last. 3 were female, 5 were male. And yesterday, 406 cases of new infections were reported to the Florida Department of Health, and we have been above 400 since Thursday. Now, the week before that, we were in 200 a day, so it has doubled. And it will double next week if we do not do what we need to do. This is a moment of truth for our county, but this is an unvaccinated issue. The vaccine is effective, the vaccine is working, the vaccine is everywhere, and the vaccine is free. It's up to you to take it and make that decision. 100% of the cases reported yesterday were among unvaccinated individuals. Although when we do our investigation, we may find a couple here and there that were vaccinated and were not in our records. But as far as we know today, after running all the data, 100% of the cases reported yesterday were unvaccinated. More so, 100% of the deaths that we are reporting to you today were among unvaccinated individuals. So we can mask up, we can keep the distance, we can try not to talk about this, but the reality is that this is an unvaccinated pandemic. It is fueling right now among unvaccinated people. And if I said it before, unvaccinated individual at this level with a variant of this level of aggressiveness, it just indicates that every time that the virus jumps from an individual to another, every time that we see a new infection, it's a new opportunity for a new variant. It's a new opportunity for genetic modification of the virus and adapt and become more aggressive. And the worst fear scenario is it could become at some point so effective that the vaccines will not protect us. And that's why we raised on the vaccine issue at the beginning of the year And we explained to the public that this was a race against the variants, that we needed to vaccinate at high levels, which we have. We are close to 60% in all individuals vaccinated at least with one dose for the entire population, not only those who were, those who are, in the age group that can be vaccinated, those that are eligible. But still, we have a 40% of the population, and we also have explained this to you. We are very different than many other places because we are a destination. So a lot of people come into our county, and we don't know and we don't have control over that. And that is good for our economy and it's good for our residents. But we have to protect ourselves and protect those individuals that are coming to visit us. So it makes a lot of sense what the mayor just announced. For those who are going to go into crowded environments, indoors, everyone should be masked if you want to protect yourself. It is your choice, it's your decision, it's not a mandate, but it's among CDC recommendations for unvaccinated people. For vaccinated people, I will advise you, if you have concerns, if you have pre-existing condition, add that extra layer of protection. The issue for us is, it's going to become, and it's getting to a point that I explained to you before, that we will start to see outbreaks as we move away from the larger pandemic that was involving everyone. And as we have vaccinated about 50% of our entire population, that include all ages, then we will see outbreaks, and that is happening. And that's not abnormal in the sense that would be the normal course of the pandemic. But we are seeing those outbreaks mainly driven by unvaccinated people, that are even putting at risk those who are vaccinated with this variant, we could have breakthrough cases, and we have seen some. With regard to the variant, we have 60 cases so far that has been reported that we know. But remember, that's just the tip of the iceberg. We know that that number is higher than 60 cases. For the vaccinated individuals, the number that we are following is eligible residents with at least one dose is at 59.69%, and eligible residents with series completed, it is at 52. So now you are seeing that the complete series is getting closer to the first dose, and that's an indication that we are not giving enough first doses. At some point, we were giving 10,000 first doses a day. Yesterday, we only gave less than 3,000, 1,288 yesterday. Now, yesterday is a Sunday, so Sundays tend to be slow. But we are not giving more than 3,000 doses a day. We should increase that rate. I also highly encourage parents, please vaccinate your child before they go back to school if they are eligible. It is important for the teachers, for the students, and for those students who are not eligible to be vaccinated, that as many of their peers are vaccinated to protect them. As I mentioned before to you, we have achieved a high level of vaccination among people who are 65 years and older, and that has increased our chances to reduce outbreaks among long-term care facilities. And that's why we also have seen a tremendous decrease in fatalities among residents of long-term care facilities because they are highly vaccinated. So with that, I will pass it to Phil for their report. But to our community, this is a serious moment. If we do not do what we need to do, it will take off from here. Thanks. Phil.
Thank you. So before I give my report, I just wanted to, just like the mayor, give a special recognition to the firefighters. And yeah, on a personal note, it was probably 2 or 3 years ago, I spent the day with the firefighters getting a real sense of sort of a sense of what they do. And one of the things they talked about was the search and rescue function and going to different communities in need. And I remember being so impressed by that, but I also remember thinking, I hope they never have to do that. And then I saw that the other day, and I just thought back to that, and I thought just what an effort it is and what a commitment it takes. And I know we're very proud. I'm very proud, and I think the people in South Florida should be very grateful that they had your efforts and efforts from, not just around the state, but around the world to help them out. So thank you all. So down to business. Tourist development taxes for the month of May 2021. Our collections were $16,890,000. That is a 1,303% increase over May of 2020. Month over month, our collections were actually a little bit lower than April's collections by about $140,000. In addition, our collections this May were about 25% less than in our last pre-pandemic May. That would be May of 2019. In fact, this month in May, that amount is less than we've collected in any pre-pandemic May since 2014. As you'll see in our chart, we continue to have had a good rebound from last April when we hit rock bottom, but we are still below fiscal year 2019. We're still below where we really ought to be. However, one piece of very good news is that this is the first month since the start of the pandemic that we didn't have to dip into reserves to pay our bills. In fact, as you will see in our cash reserve summary, our reserves actually increased by about $30,000, which is a nice change from what we've seen over the past year and a half, where we have used $145 million, and we've seen our other authorized reserve uses decrease from $181 million down to $36 million. So this is very welcome news and hopefully a sign of things to come. Finally, we will issue our June report sometime in early August, and I'll be happy to take any questions you may have during the question and answer period. Thank you.
Okay, and with that, we do have Commissioner Gomez-Cordero has joined us. I'm not sure, I don't see any of our other commissioners. We do have Scott Howard from the Orange County Public Schools that has joined us. Mark Testa from the Orange County Convention Center. Again, Ms. Diane Arnold is here if there are any questions regarding the rental assistance. And we have Chief Fitzgerald from our fire department that has joined us as well. Ilia Torres is here if there are any need for translation in Spanish. She's here to assist with that process. With that, we'll open it up for any questions at this time.
Lauren Seabrook, Channel 9. My question's for you, Mayor, and Dr. Pino as well. Ahead of Orange County voting on wearing masks in schools, and with this recommendation you're making, are you saying that you recommend children wear masks when they return to school? And also, what does this mean for the theme parks?
So we want to be clear. We're talking about in crowded locations where you cannot socially distance. A room like today, we're able to socially distance, so we're not suggesting that for such environments as that. But crowded locations, when everyone is standing a matter of inches or feet, just a few feet away from one another, we're suggesting that you consider in those crowded circumstances the wearing of facial coverings, whether vaccinated or not. Certainly for those who are unvaccinated, they should be wearing facial coverings to protect others. When we see the spread of the virus, certainly Dr. Pino has told you here today that the data indicates that 100% of those who are spreading the virus, at least within the recent past, are unvaccinated individuals. So it's somewhat, what I'm hearing them say is like it's a pandemic within a pandemic that is beginning to occur. And we have the ability as human beings to reduce the potential spread of the virus by simply wearing a facial covering and socially distancing in appropriate settings.
No particular advice to the schools. I think they will make their own decision. But the advice is for anyone of any age who is unvaccinated that is going to a crowded environment. If you want to protect yourself, you should wear a mask. I don't think that we are going to see mandates of masks. At least I think things will get really worse before we see a mandate. There's political back and forth with the mask, and as we see with the vaccines, when you interject politics, sorry, Mayor, into anything, it gets 50%, 50%, because that's how the country is. So it's a reflection of what the country is also experiencing.
And so I don't want to get in front of whatever the school district, the school board decides. At this point, Scott, they have not made any determination. Is that correct? They have not. They will deliberate on that this week. And Scott, you want to come forward and share when the school board will deliberate on that and make a decision?
Thank you, Mayor. Yeah, the board's planning on taking up the policy on the optional mask for tomorrow at their regular board meeting. So it'll be a public hearing. They'll take public input and then vote. So, that'll be decided tomorrow, and then they'll move forward with some of the other health and safety manuals and addressing that from an operational standpoint.
Okay. Hopefully that answered your question, and we'll go to the next question.
It's Steve Hudek from the Orlando Sentinel. This is for Dr. Pino, I believe. I'm interested in the number of breakthrough cases that we're seeing. And also, I'm sorry to put the question this way, but are we screwed? Is it just one of those things where people aren't going to get vaccinated?
So, we have been trying to get people to get vaccinated. And I have to tell you, I'm discouraged in the sense, and I know that it's not politically correct for me to say that I'm discouraged, but that's the real feeling. And I'm going to tell you why. Remember, I mentioned to you a restaurant that I often visit. There's a high number of unvaccinated people in that restaurant. It's a couple of blocks away from the health, one of our buildings. I promised that I will bring the mobile unit. We did that on Friday or Thursday, either day. I have to check. I personally went to that event. I went to that restaurant. I encouraged everyone in that restaurant to get vaccinated. It was raining. I had umbrellas in my car. I offered them the umbrellas. I offered them to walk with them to the trailer. We got 25 people vaccinated, none from that restaurant. So there is a...
You have to be a bigger difference.
I may try. If that works, I will give them. There is a number of people. No, there is a number of people that just will not do it, and I don't know what needs to be put in front of our residents for those who have not been vaccinated, because the large majority have responded the right way. But as the mayor rightfully said, we have now this pandemic brewing within the pandemic itself in a group of unvaccinated people that is large enough that can be disruptive. Because what you will try to do, what we are trying to do is to limit it and reduce the pandemic, kind of corral the pandemic into an age group that we can handle and manage. The numbers, the symptomatology, how many people are getting sick. Unfortunately, people are visiting the ERs. We have seen an increase in visits to the ER, but we have not seen a dramatic increase in hospitalizations yet. But that normally follows ER visits by 2 or 3 weeks. So in a couple of weeks, we will see what happened. But the concept that the vaccine is everywhere, the vaccines are over 90% effective. The vaccines are preventing death. I mean, everyone who died in the last week was unvaccinated. So if doesn't illustrate for you who are at home that there is an urgent need for you to get vaccinated to protect yourself and to protect the community at large, what else can do it? I mean, people who are dying are unvaccinated. What else can do that? How can we use this medical intervention that we have to protect our residents? Remember, there are a group of people who cannot get vaccinated. There are people going through chemo. There are people who are immunodepressed. So we have also a moral and ethical obligation to protect those who cannot vaccinate.
You know, and to add to that, the last update I had, we still have one county employee who is in a critical care unit who tested positive. And today I was notified that the sibling of one of our employees tested positive and died within the last few days. So it's still real. We'll go to the next question.
Buenas tardes, Félix Pirela de Telemundo. Mi pregunta es la siguiente. Actualmente hay un repunte de casos de COVID-19 y la variante en Missouri, por ejemplo, y otros puntos del país. Todavía ante una gran porcentaje de la población vacunada a nivel nacional y la resistencia de muchas personas a vacunarse, ¿el condado a nivel local de continuar multiplicándose los casos de COVID-19 estaría considerando a futuro implementar nuevamente las políticas de uso obligatorio de mascarillas a nivel local?
Sound like a long question, but I'm sure Ilia Torres, she
Yes,
can
I'll
translate
try to
precisely.
summarize it as well as possible. But basically, there's a concern about the spike in the cases. Would you be considering making new mandates about the use of masks and other similar restrictions?
I am not at the point at this point where I want to reinstitute a mandate. This is a strong recommendation at this time.
No quisiera tener que instituir una restricción como esa sobre uso de mascarillas. En este caso es una alta recomendación.
But we will continue to monitor these numbers on a daily basis, and we make adjustments real time based upon our actual experience here within Orange County.
Continuaremos monitoreando los números y haciendo ajustes en tiempo real basado en la situación en nuestro condado.
Mayor Demings, going along with that question, is it even possible for a local government to implement a mandate such as a mask mandate at this point because of the governor's orders, or are you guys able to work around that somehow?
It is possible, and the governor's executive order prohibits the institution of fines or any of that.
Emily Brown, News 13. This is for Dr. Pino. Dr. Pino, you said if we don't do what we need to do, by next week, these daily COVID-19 case counts would double. And right now, we're seeing those daily case counts, you said, in the 400s. So from a numbers or estimate standpoint, what specifically do you think needs to happen to prevent us from seeing the daily case counts doubling from what they are now?
We need people to get vaccinated. We need the people between 25 to 34 years old to get vaccinated. Those were a quarter of all cases yesterday. And if you wanted to be more specific, 15 to 34, that is almost 50% of all cases. And those people who are eligible for vaccine, who are mostly healthy individuals, and that's part of the issue. They don't see themselves at risk. That's part of the issue that we are facing, is that the people who are not at that level of age, 60, even 40 or 50, with pre-existing conditions, concern, they saw their peers dying, they saw their peers suffering from this, and the long-term consequences. They are people who are long haulers on this infection and experience symptoms for weeks, months. And there are people who still experiencing those symptoms today after months of having the disease. So those people, 15 to 34, they need to get vaccinated. Those are mostly healthy individuals who qualify for the vaccine. We have 3 vaccines, all available everywhere, more than 100 sites in the county. And those are the individuals that I have the most concern.
Lauren Cervantes, WKMG News 6. Dr. Pino, I'm hoping I can get a couple of numbers from you. You mentioned the dramatic increase in rolling positivity rate over the last 2 weeks. Do you know of the number of cases reported of the last 2 weeks, how many individuals were unvaccinated, and the same for hospitalizations and deaths?
We are doing that analysis. I asked for yesterday, just today in the morning, so that they can run it quickly. The idea was to be able to illustrate to the public what the issue is at, but we are going to do the last couple of weeks. And it's going to be now part of routine analysis for us to look into how many people of the infection or the death and hospitalizations are vaccinated or unvaccinated. But it requires some tweaking in our system, so it will come.
Amanda Dukes from Channel 2 News. Dr. Pino, just anecdotally, I feel like what I most often hear from that 15 to 34 age group is, well, if I get COVID, I'm not going to get that sick with it. So how do you address that comeback when they use that excuse for not getting vaccinated?
So, and that is the individual perspective. This is me. It's about me. But in a pandemic, it's also about everyone else. It's not just about you. It's about who are you going to give it to. If you have control, and you will say, well, okay, I'm not going to transmit it to anyone who is now over 40, who has nice pre-existing conditions, who is not going to hospitalize, and who is not going to die from this. So, sure, young people experience less symptoms and less hospitalization and less poor health outcomes than older individuals. But you have no control if you are going to give it to your grandmother, your aunt, or a cousin who is going through chemotherapy, because we have no control over the transmission, especially now that we are a little bit more relaxed because we were in such a good place a couple of weeks ago. That is not the case right now. The CDC has moved us to high transmission, and our numbers are continuing to increase day by day. And I alerted our community about this a week ago, and it is the same today. These today are higher than what I alerted you last week. These numbers have doubled.
I have one question that was texted in from Melissa Thomas with Florida National News for, I believe this is for Mayor Demings and for you, Dr. Pino. Her question reads, what is your assessment of the impact from Orange County's door-to-door and mobile vaccination campaigns in increasing the number of vaccinated residents?
So, the mobile unit, and we always said it, is not intended to vaccinate large number of people. That's not possible with a mobile unit. What the mobile unit is intended and is doing is to target specific places, businesses, community events, and others that may not have the ability to get to a vaccination site, so we bring the vaccine closer to them. Individuals have worked 6 days a week, or they have 2 jobs, so we hope that we can capture those somehow as we move through the community. But it's not designed to provide larger number of vaccinations. That was the convention center. That was the federal FEMA site. Those were the sites that at the beginning intended to vaccinate large numbers of people. Right now, the strategy is to use this mobile unit to target those areas that I explained to you, and also to have the vaccine available in hundreds of places across the county.
Great job, Dr. Pino. I don't see any other questions at this point, or hear any other questions. So with that, we'll conclude the press briefing. Dr. Williamson, the next briefing is when? Next Monday, we'll do the next briefing unless something else extraordinary occurs. So thank you all for joining us today, and if you want one-on-ones, some of the speakers are certainly available for that. And we'll do we'll have Task Force 4. If you all can come forward, we'll do a quick photograph.